So you're on Disability Medicare and you want to know what are some of the best options for you to help shield against that 20% that's left over, or shield you against any costs that may arise that your traditional red, white, and blue card doesn't cover. Well, then this video is for you. What's up, friends? Rob here with Agape Insurance and Financial Group in North Mississippi. Some know me as the Medicare Minister, and today I'm going to break down for you three solid options, or three best options that I believe you need to consider if you're on Disability Medicare. Now, chances are you had to wait to your 25th month if you were on some type of disability, and then they approved you for Medicare on your 25th month. They approved you for Disability Medicare. That just means you're under the age of 65. And if they have done that for you, then you definitely need to take a look at three different options to make sure that you protect yourself. Because if you don't know, if all you have is the red, white, and blue card, that's your Part A and Part B, it's only going to cover 80% of all your medical bills. And so therefore, it's going to leave you, the Medicare beneficiary, with a 20% gap that is uncapped. There's no limit to that. And that's why you want to consider one of these options that I'm going to share with you to shield yourself against that. So option number one, this is the most budget-friendly option, in my opinion. That is to put in place a Medicare Advantage plan, or Part C, combined with a Hospital Indemnity plan. I simply call it a GAP plan, and I'll explain why. But your Medicare Advantage plans and Part C plans are generally at zero cost to you. And the reason that they're able to do that is because a Medicare Advantage plan is issued by an insurance company carrier. There's Humana, there's Aetna, United Healthcare. I mean, there's a whole bunch of them out there, but just to give you some examples, and Medicare gives them a certain rate every year per Medicare beneficiary to oversee their Medicare. And so they're able to pass that on to you in most cases for zero premium. And then they add all kinds of extra benefits to it, like dental, vision, hearing, over-the-counter cards, and gym memberships, the drug plans included, and more. And so those are some of the pluses. Some of the things that you need to be aware of, though, is they do have co-pays built into the program, to the plan, I should say. And therefore, you need to be aware of those. That's why it's important that you sit down with a seasoned Medicare advisor that can help explain all that. You also need to be aware of max out-of-pocket. And that just means that as the Medicare beneficiary, that's the most that you can be responsible for in that calendar year. Here where I live in North Mississippi, the average max out-of-pocket is about $6,000 per year. So that means if I ring up $50,000 in medical bills on this particular zero premium plan, this Medicare Advantage, this Part C plan, I can only be responsible for that $6,000, but that's better than just the full 20% that's left over if I don't have anything else in place. Now, why do I recommend a Hospital Indemnity plan, or just to keep it very simple, a GAP plan? It's because Hospital Indemnity plans leave you with out-of-pocket costs. Let me give you an example. Copays for daily hospital copays. These are generally around $300 a day for the first 7 days in the hospital. And so therefore, to shield yourself against that, you definitely want to consider a Hospital Indemnity plan or a GAP plan. You have outpatient surgery copays, you have ER visit copays, and you have ambulance copays. So once again, this additional plan can help you and shield you against these copays and these out-of-pocket costs. Now, side note here real quickly. This is, as I said before, the most budget-friendly plan option out there. But if you are on a very fixed income or low income, you may also want to consider applying for extra help for your Part D drug. We can help you with that at no cost, no obligation to you. The number should be on the screen there. And if it's not, you can look down in the video description area and you can call one of either myself or one of our seasoned advisors, and we'd be more than happy to apply for extra help for you. That would be a really big thing for you, especially if you take some high-priced drugs. And then number two, depending on how low your income is, you could also qualify for what's known as the Medicare Savings Program. And that's where you could qualify for a version of Medicaid that could give you your $164.90 back, your Part B premium back, as well as unlock some other benefits for you. So once again, that's the most budget-friendly option. Before I share the next two real quickly, if you're getting value out of this video, please take a moment to like, turn on your notifications, subscribe to our channel, comment, and let us know if there's some additional questions that you have or some feedback that you have from this channel, because all of that helps us get better found in the YouTube algorithm, and it allows us to help more Medicare beneficiaries like yourself. Option number two, and what I believe is the second most budget-friendly option, is get on what's known as a high deductible G plan. It's like a regular Plan G, except for the fact that where you only have a $226 deductible with your regular Medicare Plan G. And what I mean by regular means if you were turning 65 or older and new to Medicare, the high deductible Plan G comes with a $2,700 deductible, okay? It covers the exact same benefits. However, before the plan starts to cover anything, you have to meet that $2,700 deductible yearly. So this is a good plan if you're on Disability Medicare, but you don't go to the doctor a lot, you don't have a lot of medical expenses. This could be a viable option. And I just want you to know a couple of more things here real quickly. Number one is you're responsible for the Part A deductible and the Part B deductibles and co-insurance. Part A deductible deductible is $1,600 for 2023. Part B deductible is $226. Okay, and once you meet the Part B annual deductible, Medicare will pay 80% of the approved cost of the Part B services. This means that you, the Medicare beneficiary, will pay the other 20% until you meet the $2,700 deductible. But any amount that you pay towards the Part A and Part B deductibles, that is all included in that $2,700 deductible. Okay, so I want to be very clear about that. That works just like a regular Plan G. However, the deductible is substantially higher, but it's going to keep your premiums really, really low. Now, the next thing you need to know about is if you go with this option, unlike option number one, the Medicare Advantage route, you do not get a drug plan. You have to get a standalone drug plan. It's not included in the plan. And then you have to get any other ancillary plan that you may need to address your health care needs. So once again, with the high deductible, you're still able to keep your premium really, really low. Now, option number three is the highest premium option there is, and that is just to get what I call a regular Medicare supplement, but you're not going to get that turning 65 rate. See, when you're turning 65, you get a substantially lower rate than you would if you just get a regular supplement rate and you're under 65. So let me say that again. If I was turning 65 today, my rate would be substantially lower than if I was just to get a non-high deductible Medicare supplement plan, meaning all I have to pay is the $226 deductible for the year, but pay a significantly higher premium, okay? So in other words, instead of a high deductible Plan G, just a regular Plan G with only the $226 annual deductible. That's the deductible for this year. That's the Part B deductible. However, in my experience, I've seen these premiums be 2.5 times higher than just your regular turning 65 Medicare rate. And so if your budget's not a concern and you don't want to pay the really high deductible, like in the high deductible G plan, then this definitely could be a viable option for you. However, it's going to be high. Okay, it's going to be a significantly higher premium, and you still have to get a drug plan, standalone drug plan, and any other ancillary plan that you may need to help you cover or shield you against any healthcare expenses that may arise. So let me quickly recap. Option number one is a Medicare Advantage plan or Part C plan, Hospital Indemnity plan, or a little gap plan in place to give you that extra protection. Option number two is a high deductible plan where you have a significantly higher deductible but lower premium. Or option number three is where I go with the higher premium but lower deductible. And once again, option number 3 is for those that budget is not that big of a concern. In other words, you can afford it. Well, once again, please take time to like, comment, subscribe below, turn on the notifications. That way you're notified every time we drop fresh content like this. Always feel free to reach out to us for a no cost, no obligation review. We work pretty much in every state. And if we're not in your state, we have a group of seasoned advisors that we trust, that we can point you to them, and they will take care of you if we're not able to. But please call us on the number on the screen. And if it's not there, then it will be in the video description box for sure. And I just want to say God bless you guys, and we'll see you on the next video.